Her topic today is multidisciplinary treatment plans, comprehensive solutions for complex cases. Ladies and gentlemen, Dr. Susana Palma Moya.
Thank you very much. Well, I am going to talk a little bit about lower arch mesialization, okay? And yesterday, we have the opportunity to hear our friend talking about how to correct the class 2, okay? And I am going to give one more option just to correct the class 2, okay? Like Enzo spoke yesterday. And so traditionally, we have considered the mesialization of the lower arch a little bit difficult when we are dealing with aligners, okay? And so I am going to focus in some multidisciplinary cases to explain you how we deal with these cases. And so today we are going to be talking about lower mesialization in my lecture. And whenever I'm going to be, if I want to open a space, for example, for an implant, and I want to mesialize the lower arch just to open a space for a missing tooth, traditionally, what we were doing was start with the ortho treatment. So it was the orthodontist, the one who started the case. We were looking for parallelism in between the root. We were looking for a prosthetic clearance for the crown of the implant. And after that, when we have made the room, make the space for this implant, we were calling the surgeon just to place the implant. But what do you think we can do in cases like that? We have a case like that with a full class 2, okay, with a deep bite, a strong deep bite, with a periodontal problem that has missing first molar in the upper arch and in the lower arch, and with a lingual tipping of this lower second molar. So where I'm going to have my anchorage just to correct this class 2, where I'm going to have my anchorage just to correct the deep bite, okay? Check the X-ray so we can find this lower second molar totally tipped to mesial. So look this periodontal pocket. Do you really think we can use those molar just to level our curve of spit? We also have a proclination of the lower incisor. We need to upright this lower incisor in order to correct the class 2. And I am just afraid that if I try to use this 7 as anchorage, I am going to finish losing them. So in those cases, in my opinion, it's better just to think a little bit differently. If it's a multidisciplinary case, if we have already a class 2, a full class 2, that we are not going to close the space of these 36 and 46, why don't we place the implant from the very beginning? So we have to change our mindset. We have to think that our co-workers, the surgeon, the periodontist, are there to help us in our treatment. So in these cases, what I'm going to do is exactly the opposite. I am going to ask the surgeon to start first and to place an implant, even though maybe we don't have the space yet to place the implant of a size of a 36 or a 46. So this is the evolution. You can see at the moment, you see here in the photo that we have already upright the lower incisor. Check the difference, how they were totally tipped to lingual, and now how are they totally straight. So now that I have anchor the root to the cortical bone, I can place this small sectional wire of 0.14 of pupernite that is going to make this movement, okay? It's going to apply this mesial crown tipping to the canine and the premolar, and distal crown tipping to this molar. So it's going to be beneficial because it's going to proportionate more efficiency to the movement of my aligner. I am going to be more efficient moving both teeth at the same time. So check how much space we have been able to open for this implant. And we have not proclined in excess the lower incisor because we have this stat in the retromolar zone just to prevent an excess of proclination.